Hi friends, I'm Dr. Chirag Thonse, shoulder and knee specialist, Manipal Hospitals, Bangalore. Rotator cuff is a common name given for a group of four distinct muscles and tendons in the shoulder joint, which brings about mobility and stability to the shoulder. These group of muscles arise from your shoulder blade or the scapula, go on to be inserted into your arm bone. Now, each one of these muscles or tendons have a distinct role to play in your arm mobility and your arm stability. So it's very important that one has a good rotator cuff muscle complex for a good mobility and stability of the shoulder. Now, how does a rotator cuff tear? A rotator cuff can tear due to various reasons. One is a traumatic tear, and this happens usually in young active individuals while playing sport or because of fall or trauma. These are called the traumatic tears. Another subset of population who come to us are these elderly individuals with a rotator cuff tear, and these tears are called the degenerative tears because of various reasons, either because of a shoulder impingement, that is a pinch of this bone on the rotator cuff tendon over the period of time weakens the rotator cuff and hence resulting in a tear of the rotator cuff with a small trivial injury. These degenerative tears of rotator cuff has to be handled with a little bit of a care, and the approach may not be as similar to a traumatic tear. The rotator cuff tendon could either be a partial tear or a complete tear. A partial tear would be a partial width of the tendon being torn. A complete tear would be the complete width of the tendon being torn. The treatment modality for a complete rotator cuff tear may vary from a conservative treatment to a surgical management. The surgical approach is what we are going to talk about today. It may vary from an open repair to an arthroscopy or a keyhole surgery, which is quite popular in today's date. An arthroscopic rotator cuff repair would mandate visualizing the rotator cuff through a keyhole surgery, identifying the tear pattern, and repairing the tendon tissue into the bone where it belongs to. A torn rotator cuff tendon is repaired to the bone where it belongs to by certain modalities. This is suture to the bone with a suture anchor. It could either be a single anchor, two anchors, or four anchors. One of the problems of a rotator cuff tear or a rotator cuff pathology is the healing process. Because of the weak biology and the less blood supply to this tissue, the healing process of a rotator cuff tear or a rotator cuff repair takes a longer duration of time. And this has also been one of the reasons why rotator cuff repairs have failed in the past. We have been wanting to have a biological solution for these kind of rotator cuff tears, and in today's date, we have an apt solution for these kind of rotator cuff tears where one could augment the biology and improve the healing potential of your rotator cuff repairs. The biological solution for this rotator cuff repairs is the new kid in the block, which is called as a biological augmentation patch. Once the rotator cuff repair is done, we would then augment the repair by an bioinductive implant, which would improve the healing potential of your rotator cuff repair. And this bioinductive implant is nothing else but a type 1 collagen. The function of this bioinductive implant is to provide a scaffold, improve the healing biology or the healing potential of the rotator cuff repairs. Over the next 6 months, this bioinductive implant becomes nothing else but a healthy, good rotator cuff tendon which incorporates into your natural tendon, hence providing additional bulk, additional strength, and an enhanced biology for the rotator cuff repair. The bioinductive implant provides that scaffold and a quicker rate of healing, where the tendon thickness post-surgery increases exponentially with the bioinductive implant. Hence, bioinductive implant is a challenging device for the rotator cuff tears in case the patient is wanting to return back to sports early, would return back to his functionality early with a good rehabilitation program to follow. Thank you.